They break them down.
Good afternoon, everybody. Well, thank you all so much for coming to the presentation. I know we got it going pretty quickly, so thank you so much for that. The presentation is at the request of the Health Services Committee here as part of our resident council. They wanted all of our residents to have the opportunity to hear a little bit more about the services and opportunity that SeniorDocs can present to our residents. We've had a great relationship with them over the last couple of weeks, helping us get some things in order. And I thought this would be really, really great for you all to ask questions to the SeniorDocs team about the services that they do provide. So I'm going to invite Patrick and his team up and they can take it away, but please feel free to ask all the questions that you may have.
Good evening, folks. Thanks for having us. It's a pleasure being here on behalf of SeniorDoc and Dr. Thomas, who's our medical director, and Natalie Robinson, our nurse practitioner. We're going to do a little explanation of who we are, but we want to make sure we get a chance to answer all your questions, because that's usually what most people have, since I think many of you were here a few weeks ago when we actually introduced ourselves with the IV team. So we can. You want to do it sitting down?
Sure, we can do it casual.
It's up to you. We can stand here, look all stiff, or we can sit down and answer your questions. Is that okay if we sit down?
Okay, let's sit down.
Is this okay for everybody? Okay, perfect. We want to keep this casual, informative, and answer all your questions. Again, my name is Dr. Thomas. I've seen a lot of familiar faces here. It's good to see everyone again. I will basically reintroduce myself. We'll introduce Natalie, and we will summarize what SeniorDoc is. I know some of you have heard this speech already. We'll keep it short. But then I think the most important thing is opening up to questions, because people will have individual questions. Okay. As Patrick said, we were here a couple weeks ago. I know that I've met a lot of you already. A lot of my interaction with you as individuals was filling out logistic forms, those 602 forms, and taking care of some medical documentation that needed to occur. And we have finalized most of that. There's a couple more forms that need to be completed, and we'll be knocking on your door today and over the next week just for some couple quick questions. But I think where we go from here is, for those that are interested in our services, and I'll reiterate what our services are, is that we're going to be working, Patrick, myself, Natalie, and getting to know you as individuals, okay? Getting to know you as individual people, and also addressing all your medical concerns. So to briefly introduce myself, my name is Dr. Thomas, Jeff Thomas. I've been with SeniorDoc for a little over 5 years now. I grew up in San Diego area. I went to UCLA. I did some training back east in Boston for medical school, then came back out to the West Coast and completed my residency training at UC Irvine. I've worked both as an internal medicine specialist, both in the hospital as well as outside the hospital, with a focus on geriatric care for the last couple of years. I have 2 little boys, 6 and 4, who have a lot of energy, and they're both little hockey players, and they like to play hockey in the house when they can. So that's where my weekends go, is my wife and my two boys.
Hi everyone, my name is Natalie. I am a nurse practitioner. I am new to SeniorDoc, but I've been born and raised here in the Coachella Valley, so I don't plan on going anywhere. I've been in the medical field for about 13 years now. I am also working at Eisenhower Medical Center, so I do inpatient care as well as primary care. I'm excited to meet you all and work with you and hopefully answer questions that you have.
Okay, so SeniorDoc, what is SeniorDoc and what we can do for you? Again, I know some of you have heard this already, I'll keep it brief, okay? SeniorDoc is a mobile medical practice, okay? We serve the family medicine, internal medicine needs of individuals, okay? The mission statement of the company is guiding people to better health, okay? That's what we do. All right, we are the forefront of your medical care, okay? And the advantages of our business model is that we are a continued presence here at this community, okay? We both plan to be here on a weekly basis, all right? We will address your medical needs on a near daily presence here. Okay, what I mean by that specifically is a lot of you have already signed up for our services, and as we grow, our presence will grow here as well. Right now, we plan to be here 1 to 2 days a week with on-call 24/7 care, okay? Meaning that our office is open 24 hours, 7 days a week with a medical provider, okay? In terms of physical presence, we'll be here at least once a week, preferably twice a week, depending on how many patients, or I say residents, sign up. Okay, that is the current model that we have, just to be perfectly clear. Okay. At this process, I know a lot of you are associated with Eisenhower Medical Center. I'm currently in the process of getting my privileges for Eisenhower. So meaning having access to your medical records, and even being able to check up on you in the hospital is something that I will be able to do. Will I be your main doctor in the hospital? No, I will be working in conjunction with them, okay? Natalie, and this goes for Natalie as well, we will also be working closely with your specialists, okay? Another clarifying point. A lot of you are already on home-based services, such as physical therapy, or occupational therapy, even podiatry. You can still continue those services, okay? We do have our own, but we will pair with the resources that you already have, okay? Now, a main question that we get is, can I still keep my primary care doctor? Yes, you can, okay? We like to be your primary care doctor because it's better to have one cook in the kitchen per se, okay, meaning one main decision maker, all right? Because a primary geriatric physician, okay, or a primary internal medicine physician or nurse practitioner, we're the quarterback of the team per se, okay? We direct a lot of your medical care and we coordinate a lot of your medical care. If we have multiple doctors making decisions, well, guess what? That sometimes can create confusion. Okay? If we are your quote background physician, which we're more than happy to be, because we're going to have a continued presence here, meaning that if something happens and you can't see your doctor for 2 weeks, or you need an urgent refill of a medication that you can't get hold of your doctor, okay? We can be that supplemental medical provider. But we do ask that if you want us as that service, we need to see you once in a formal manner to create a chart so we know who you are and what your medical issues are, so we're not caught off guard when we do see you on a urgent basis. Okay? Our whole point is to keep you happy, healthy, okay? in the least stressful way possible. Okay. Now, do you have any things to add? All right. That's a brief summary. I think at this point, questions? Yes, ma'am.
My question is, if you have your own primary and something happens and you need to go to urgent care, can, like my mom, give you a call? Can she be seen by you as like an urgent care doctor?
Yes, a lot of times we take care of urgent needs. Okay, so if we're here physically and something that can wait within 24 or 48 hours until we're physically here, we take care of that problem. If it's more of an urgent need, we do telemedicine. Okay, I will give you an example. We see a lot of urinary tract infections. Okay, these are urgent needs. Okay, these can create serious medical problems, and a lot of times these urinary tract infections, they don't happen during business hours or Monday through Friday. Okay, it's Saturday and you're feeling uncomfortable. Okay, well, what happens is that instead of the stressful event of going to urgent care, you call our office. Okay, and one of our medical providers, for example, I'm on call 10 days a month. Okay, so a third of the month I'm on call 24/7. So if you call me on Saturday and say, hey, I'm having these symptoms, then I can write an antibiotic, okay, into your local pharmacy that will be delivered same day, and then we can schedule a follow-up if needed on a Monday or Tuesday. Okay? So we try to prevent a lot of residents going to the urgent care. That's one of our business models. Now, the emergency room, if you're having chest pain or shortness of breath, that's different. Okay?
I have two questions. One, do you envision having a room here for us to go, or will this, your attendants, to take care of us, go through our room?
Okay. So the question was, do we plan to have a clinic, a physical clinic here, or go to your rooms?
Yeah.
We go to your bedside, we go to your rooms, okay? We bring equipment, okay, mobile equipment to your room, as well as things like blood draws, imaging. We come to you in your room, okay? The need for a structured clinic, especially from a primary care perspective, is something that we feel is not needed. We are the old school method. We've gone 360. We've gotten the doc in the black, bag, the doctor's bag, and we're coming to you.
And when you say we're, it's you two, not part of the other 28.
Correct. Right now, it's Natalie and myself, and then whatever other support services, such as a phlebotomist or a lab technician, will come to you.
Thank you.
So if you needed a lab test, for example, for a UTI, somebody would come to us to take our sample and take it to a lab, or what?
That's correct. Some of you have already experienced this already, where we have a mobile lab technician that comes to you. So if you need a urinalysis done, if you need blood work done, basic imaging, ultrasound, x-rays can be done in the presence of your apartment.
Does this work with an HMO?
So we do, unfortunately, most HMOs we do not take, okay?
You don't take HMOs?
Some of the HMOs we're not contracted with, no. But we do have a insurance broker that can guide you to other options. Unfortunately, it's just how contracts work with HMO systems. They're very restrictive in terms of how and who a patient can see.
I'll ask you, the Big Pacific, do you take Humana?
PPO, yes. So we take all PPO.
Are all of your doctors MDs?
So in terms of the company, no. But for example, I am an MD, Natalie's a nurse practitioner.
When I make a call and I'm talking to a doctor, am I going to be talking to an MD doctor? Or are some of them not MD doctors?
Correct. So her question is what type of medical provider, if someone calls the on-call number, will someone be talking to? So we have a mix of medical doctors, MDs, physician assistants, and nurse practitioners. And the medical doctor also includes the DO label. Okay. So, but for example, 10 days a month, it's myself, so I am an MD. In terms of the associated physician here at this community, it's going to be me. There won't be another doctor.
No residents.
No, sir, no residents.
In your flyer, you had a disclaimer about Oakmont that you're not associated. Is there where are you associated within this organization here that has some accountability or hold you for accountability? Obviously, there must be some level of care that you provided or plan to provide, and that would be part of the agreement. How is that working?
So if I understand the question correctly, you want clarification on the partnership between Oakmont and SeniorDoc.
Well, you already just had a disclaimer said you have none, but is there some, we got Ivy, Ivy wasn't mentioned, I don't know, is someplace else in this layer of organizations here, is there somebody that has made an agreement with you to allow you to come in here and do this and then have accountability for that?
So, hopefully I can answer this question correctly. In terms of a financial or legal relationships with the Ivy or Oakmont, SeniorDoc does not have one, okay? We are a standalone enterprise that basically Oakmont has allowed permission to come into the community to perform services. So in terms of medical outcomes, it is the sole responsibility of SeniorDoc.
So there's no connection for operational activities here, that what you do, the things that you do, there's no connection with any management level in this organization. You're standalone, but you get permission to do that.
Yes, so from a business legal standpoint, no. But from a functionality standpoint, we have a business or I should say a working relationship with all MedTech's wellness directors here, where they're an integral part of the team. So we work closely with them on a daily basis, if that answers your question.
I see that on this page that I took one of your brochure things in the back with all the thousands of pages in it, and one of the pages, it says Chronic Care Management Program, which I thought sounds pretty interesting. Have you explained that already today? Or
I have not. Okay,
can you
so
briefly explain that?
no problem. So in the packet, there's two steps that are involved, or two general, logistic steps that are involved in becoming part of SeniorDoc. Okay, one is insurance and chart creation. Okay, we need to make sure that you're eligible for our services. Okay, the second step is the packet that some of you have, and that is in the back of the room. Okay, this packet gives us legal authority to treat you. Okay, medical release of information, chronic care management, and I'll explain this, as well as remote monitoring eligibility. So those last two things, chronic care management. When we talk about healthcare management in the geriatric population, okay, meaning all you here, okay, some of you are quite healthy, no medications, doing great, But some of you have 3 pages of medications, have 3 pages of health concerns. So, as a healthcare provider, okay, that is an extremely complex and daunting task. We need to stay on top of all these complex medical conditions, okay? And a lot of it has to, when I say on top, it needs management. So when we identify a complex medical patient, we have an extra layer of support in the office, okay? People with medical backgrounds that do active chart reviews. They give patients regular calls, regular check-ins beyond what we provide to ensure the stability of their health issues. Okay? It's that level of micromanagement as well as attention to detail that is needed to make sure that individuals stay healthy. So it's an extra level of support. Now beyond that, we do have a remote monitoring system. These are remote devices that are tied into the office. To give you an example, let's say someone has a very complex heart rhythm, atrial fibrillation, okay, for example. I know some of you probably have that here in this room. Let's say that your atrial fibrillation is stubborn and is very difficult to control and is causing a lot of symptoms. Well, then we can attach a remote monitor and we can actually chart and see when someone is approaching an unstable heart rhythm or heart rate. And then that's an early warning system for someone in the office to notify, for example, Natalie or myself, to say, oh, Miss Jones, her heart rate's going 140, and she's been doing that for the last 6 hours. We need to give her a call, make sure she's okay, or figure out what she's doing at that time.
So in the paperwork, so it's just for real chronic issues. You're asking to be given permission for a once a month charge of 20 minutes of your time, which is for charting and for examining those issues.
Yes, correct.
Okay.
So for those that don't need it, don't sign it. It's okay. All right. However, I can tell you that typically when patients are on 4 or 5 medications, anything more than that, even including supplements, okay, it is important to have that monthly or that 20 minutes initially of extra time to make sure that these issues are stable. And it is something that is billed to insurance.
Yeah, I figured that's what you were trying to do.
Yes, I understand that the company is established in Orange County. Can you tell us some of the similar organizations or care facilities that you work in and that you have worked in?
So actually we're central in Orange County, but we're in 5 states, growing to probably 8 states in the next month or so. We have 60 plus medical providers, plus at least the same number of back office staff. We are closely partnered to Oakmont's, Atria's, Pacifica's, Watermarks. These are all large enterprises that focus on assisted living, independent living, meaning structured living, skilled nursing facilities, such as the one just down the hallway here, okay, meaning similar healthcare models throughout Orange County, throughout California, and 4 other states at this time.
Earlier you said you had applied, I forgot what the term you used, but in connection with Eisenhower and the specialists. Do you have a kind of a best guess on when that will be in place? Because most of us are actually getting treated by specialists as opposed to just the primary care.
Correct. So to answer this, the question was how long until I get approved for privileges through Eisenhower? As long as you sign a HIPAA release form, I can get all medical records from any specialist now. Okay, so there's not going to be a delay of me seeing your medical information. But actually to go into the hospital and access your records that way, that takes a little bit of time. Depending on how quick they are, it usually takes about 2 months to get privileges. That's usually on average.
If you need a blood test, you come and draw the blood. What lab do you use to get results?
There's multiple companies in this local area. Do I know the exact names of them off the top of my head? I do not.
So it could be a number. How fast can we get a result from a blood draw that you would take?
So it depends on the level of how we order it. So if it's stacked, usually if I order it in the morning, there's a potential of doing it the same day, getting the results. I can tell you right now that I've ordered blood here already on a routine basis, and it takes usually on average 48 hours to 72 hours to get the results back.
Along the same lines, if you're a person that needs blood drawn fairly regular, though not every week or something, you have to have conversation with a medical doctor to approve that before you can get it done.
Yes, there has to be some degree of communication. I do have to put the order in on an individual basis to have that done. Did that answer your question?
I think so. I mean, it's.
So I think I know your question. Hey, Dr. Thomas, I got some blood work done. I need it done tomorrow to measure this level or check this result. I can order it without having a formal appointment and seeing you. I just need to eventually follow up with you sometime to review those numbers. And from an insurance standpoint, I need to have documentation that I saw you physically, or at least had a conversation with you regarding the reason and the results.
Those of us who have for years lived here in the desert and have a relationship with different doctors connected with Eisenhower, we can look at my chart and get all of the information, historic information as well. Will any work that you do for us individually, is it going to ever show up on my chart?
So our chart, our electronic medical record system would be separate from my chart. What we're working on actively right now is that our medical record system just upgraded 2 weeks ago, and we hope to create a patient portal here ASAP so you have the same functionality as my chart.
It would have to be, two places I'd have to keep track of.
Unfortunately, yes.
That's
Yes.
what I.
Me? Yes. Do I understand that you do have portable equipment, for example, X-ray equipment, that you could bring to our apartment to take X-rays?
Well, yeah. So yes, we use subcontractors to do that. Okay, so meaning a local company here that we have a partnership with.
I see.
So let's say that you have a cough or there's a concern for pneumonia. You need a chest X-ray to see if we see pneumonia. Yes, we have someone that comes here to do that.
And one other thing, you mentioned something about physical therapy. Do you have physical therapists on staff that if we needed physical therapy, we get it through you?
So you can always get physical therapy through us. It would not be under the SeniorDoc name. Just to clarify, when we talk about services such as physical therapy or lab draws or imaging, okay, we partner with people out here in the community that perform those services.
So you don't necessarily, it is not someone employed by you that will come and draw the blood. It is someone from one of the urgent cares or whatever would be sent to do that.
Correct.
So for those services, are they covered by Medicare the same way as I am taking a mother to a lab or taking her to an X-ray?
Exactly the same.
No additional cost?
No additional cost. So that's what's so beautiful about this model is that we're bringing a lot of resources to you that a lot of people charge a concierge fee, okay? We're actually basically a concierge service. You know, a lot of people charge $5, $10, sometimes $20,000 to come to you, okay? We've rid that model, okay? We're not in the business of going to a community, seeing 5 patients out of 100, okay? We'd rather see 75 out of that 100 and rid the expensive concierge fees, okay? And also, as from geographic region, we pair with the best services possible, okay? It's more reasonable because also people like variety or selection of certain services. For example, physical therapy. You know, I like Bob from Accent Care. I don't like Maria from, Pacifica Care. I want to go with Bob. Well, by not having these people employed under the SeniorDoc name, we can choose the best service. Okay? So that is advantageous to you because we can select the best out of, for example, the 10 physical therapists in this area.
This is all covered by Medicare?
Yes, ma'am.
You have a listing of the providers or specialists?
In terms of in this area?
Yeah.
Yes, so Natalie and I are working and establishing close relationships with select cardiologists, GI doctors, so on and so forth, as we expand services in this area.
You don't have a listing now?
In terms of preferred, no, but in terms of having a list, we have access to the information. Was that your question? Let's say that you needed a cardiologist, okay? Right now, we are learning about who's who in this area, okay? Who we feel is making appropriate medical judgment and who has good relations and who has good lines of communication. So if you want a preference list, like Dr. Wong is better than Dr. Thomas as a cardiologist, I don't have that list right now. We are still new to this area and we're learning things quickly.
So currently, my experience has been if you don't have the primary care that is associated with Eisenhower now and you need a specialist, it's near impossible to get into Eisenhower network without that referral. So assuming my mother was with you as a primary care now and she needed a cardiologist, who would you be able to refer us to? And could you refer us to someone in Eisenhower?
So, to answer that question, I've never had a problem referring patients out in any geographic region that I've worked. And I've worked through all of Southern California. So just not being able to see a specialist because I'm not associated with Eisenhower, I've never experienced that before. But that's all going to change hopefully in the next month or two because then I will be associated with Eisenhower Hospital once I get privileges. So it's all about forming close relationships, working relationships with specialists, okay? And that is already being developed with some of my conversations with patients that I've already established here already. So exchanges of cell phone numbers, knowing the nurses in the back office, all those relationships are occurring right now. Having a specialist block one of us because we're not having an Eisenhower name behind us, I've never experienced that anywhere else.
I guess said differently. For example, one time we may have been looking for a neurologist.
Okay.
Like to find one in the valley is not easy. To find a good one in the valley is not easy. So I'm assuming you coming from Orange County, you probably have more connections where you currently work. Yeah, I wouldn't want to have to drive her to Orange County to get your best suitable doctor.
Correct, and my knowledge base of specialists is growing exponentially almost on a daily basis. In terms of just because I'm new to this area, if that limits my ability to refer to specialists, I've never had that problem before. So, for example, if you need a neurologist, if you need to see someone within 2 weeks, I can write a stat neurology referral, and whoever that I send that to, they can't legally deny it just because I don't have an Eisenhower name behind me. That violates certain laws, Stark laws, that you can't deny a patient because of where they came from.
We already have specialists in this community through the Eisenhower community. We want to keep those specialists, and they may not be on your list. Probably would be, but they may not be. But whatever they do has to eventually feed back to you as a primary, and so there's no problem with that connection.
No, so what I do in these situations is I have a care manager, meaning someone in the office that helps me through the logistic steps. So let's say I see you next week and you say, hey, Dr. Thomas, I'm going to see my cardiologist in the next couple of days. Well, then I have Kim, my assistant, Kim, call Dr. Jones's office and obtain those cardiology appointments and upload them to our medical chart so I am updated in terms of the latest specialty care.
Once you have hospital privileges at Eisenhower, does not mean you're going to have access to all of the doctors associated with Eisenhower.
It's my perception that Eisenhower is on the Epic system, so once I get access to Epic, I should have access to all notes.
Do you understand the difference in the care that people that go to Eisenhower get if they're part of the 365 program, or if they're just an ordinary person like I am?
Yes, I understand a little bit of the 365.
There's a definite, those of us that have lived in the desert a long time understand these things because we've dealt with them, good and bad. And so I need to know how familiar you would be with that. Also, how many other senior communities are you the primary doctor for?
As of right now, just here. I'm focusing on just this community right now.
And it will depend on how many of us sign up, whether we can keep just you here.
Correct, that's correct.
Okay.
So I'm new to this area, okay? I'm not downplaying that. But what I am promoting is a model, a healthcare model that emphasizes the ease of delivery of care. That's what I'm promoting at this point. Even the 365 Eisenhower program, which is a good program, okay? It works excellent for some people. It does not work well for others. So our service fills in that gap. So financial issues, mobility issues, medical complexity issues. We fill in that gap. I'm not saying we're the right business model for everybody, but I know from experience that it works for majority of people. Okay?
Do you live in the desert now?
So now that lives in the desert, I do not.
You live in Orange County?
Yes, ma'am.
I can add a little bit more about Epic.
Go for it.
So I am currently employed by Eisenhower, so I know very well how my chart works. And what you guys see as a patient, your view is different from what we see as a providers unless we have privileges with Eisenhower. So once we do that, we can go onto your chart and we can see all your specialist notes. We can see your primary provider's notes, all your hospitalizations to way back when. So to answer your question, we will definitely have that access and we'll be informed as who you're seeing, for what changes they're making, and we can keep track of those things.
Question? How do you handle routine INR checks?
So do you do them yourself with your own machine? So I ask you to report the number to me, and sometimes what I do is usually once a year I make sure that your machine is calibrated correctly. So sometimes what I do is I calibrate it with an outside blood source just to make sure that the numbers are on the same page. So in terms of if you do your INR checks yourself, you report them to me.
Just continue to do that.
Yes, sir.
I do it through service. And they report it to the top.
Okay. So yes, we can keep the same service. Some people have their own machine and do it themselves. Okay, it just, again, we want to seamlessly integrate into what is already present and what works for you. We're not here to take away or change anything unnecessarily.
There's a hospital in Indio that I suggest you look into registration for, because a friend of mine was taken by the fire department ambulance, and instead of going to Eisenhower, they took him to the hospital in Indio, because they said their instructions are to go to the closest spot. So.
Desert Hope is the hospital you're talking about, or which?
No. The name of the hospital is
JFK.
right now. Oh, Kennedy?
I'll definitely look into that. My goal and how I do it in Orange County is I get privileges at all local hospitals, so I appreciate that point.
Okay,
Excuse me, will you be adding more doctors or nurse practitioners to service the people here in the valley?
In the valley, yes, there's a strong possibility for that. Just depends on how many patients are interested in our services. But what I can say is yes, probably our practice is going to grow quite significantly. The model that we're doing here is we're doing in Orange County area, and we know an exponential rate of growth in that area. So yes, we will likely add more nurse practitioners and physician assistants and doctors in the area as we grow.
How many patients can you and Natalie handle?
So that's a very good question. So right now, I would say that if you look at logistic-wise, you're probably averaging between 10 to 15 patient encounters per day maximum, okay? So times that 5 days a week, you get kind of an idea that this can grow. I won't be complex. My goal is to keep my practice probably several hundred patients or less for me alone. I'm not here to have a 5,000 patient practice, okay? That's not my style, and that's not the business style. The business style is to keep the numbers small and appropriate so you guys get individualized care, okay? We're not a Kaiser model. I know some of you have Kaiser here. I'm not talking bad about Kaiser, but I'm not here to see 35 patients a day, okay? I'm here to see less than 15 per day, spend some time with patients, and go from there.
With regard to your appointments, say you're going to be here next Wednesday and all day, will you be giving people a specific appointment time? So if I wanted to be with her for the appointment, I know it's at 1 o'clock and I'll be here at 1 o'clock. Or do you just show up at her door when?
No, we have a scheduler, and we try when family members are present. It's always much better as well. So we give a set schedule.
With regards to labs and X-rays, for example, if we wanted, it was more convenient to go to Quest at the time, or Lab Quest, or even to Eisenhower for an X-ray. Your labs and things like that are transferable in place?
Correct.
Are there any initial fees for signing up because of the amount of paperwork that's involved? If so, there's some kind of initiation fee to join your practice?
No, we want to get away from that model. So there's no initiation fee. It is we try to keep things as simple as possible. It's just that if you want to use this as primary care physician or even as a background doctor, we do ask that we need one formal visit to establish medical records into our system.
It hasn't been asked or mentioned. Is there an annual fee or monthly fee, or how do we pay for this?
No, it's all through insurance.
Dr. Thomas, the people back there can't hear the questions at all.
I apologize. So the question was, is there any annual fee or any outside fee beyond what we charge insurance? The answer is no. We are trying to we're not a concierge service, even though we present ourselves one, okay? We'd rather see more patients rather than a select financially beneficial few, okay? So there is no extra fee for our services.
So how do we get on your program?
Okay, so I think that right now there is a packet back there on the orange cloth table. Patrick can show you that form. So there are some certain logistic steps that have to happen before we can actually see you. And that is filling in that packet that gives us medical legal authority to treat you as individuals. And that goes both for patients or people that want us to be their background provider as well as their primary care provider. Okay? So that form has to be filled out before we see you formally. Then what happens is there's a number on there that Patrick can walk you through it as well, where you can call our intake number, okay, and they can walk you through the steps where to send those forms, or you can give them to either Molly or Rebecca here at this community. Those forms are uploaded into our system, and then we schedule an appointment with you. Okay. Now, some questions were asked. How do you get hold of us? Okay. I have my business card, which has my personal cell phone number on there. All right. I answer that phone on a daily basis, but I ask that you only call me if you have an urgent matter. Okay. Just to chat is not going to work out. Okay. All right. Also, we have our formal office number on there, okay? So you call the office, all right? Then they get you in touch with our care manager, and she helps coordinate any active issues that might arise. For example, if you need some clarification, refill, if you want to schedule an appointment, so on and so forth, all that is handled through our office. I think we've answered now at this point. I know we've answered a lot of questions. Nana, do you have anything else to add at this point?
What is your,
I'm a nurse practitioner. So I'm a nurse practitioner. I can provide similar services as Dr. Thomas. I can come see you, manage your medications, order x-rays if we needed to, order lab work, do referrals for you to specialists, those types of things.
We're a team up here.
How many days a week will you be here?
Myself, I'll be here once a week for sure, and Dr. Thomas as well.
At the same time?
Different times.
It's going to be flexible. The question is, how often are we going to be here? It's one, when we need to be here, and the second one is scheduled times. Okay. Again, if we have a large amount of people sign up for our services, that means we're more of an established presence here, okay? If we have, well, we already had quite a few people sign up already, but if it turns into a large number, that means that our presence will be here several times a week. It depends on what is needed at this point. It's a beautiful campus, but I'm not going to walk around and say hi if I don't have patients, okay? That's the reality of the situation.
is this the sign up you're talking about?
Yes, yes, sir.
Okay, well, I turned that in, but I didn't see any place where I was signing anything, and I haven't heard anything as a result.
Okay, I'll walk you through it here in a second. Patrick can help you walk through that packet as well.
I filled it out already and turned it in.
Sure, then that's perfect, and you and I can touch base and we can go from there.
Dr. Thomas, are you limited with a number of patients that you can accept from our community?
As of right now, the question is how many patients can we accept at this point? Right now we have staffed appropriately where if we have 50 to 75% of the patients sign up here, we're adequately staffed, okay? We are only focusing on one community at a time. We are not going to other communities at this time until we satisfy the need here first.
You're assuming that most people have PPOs.
Correct. Yes, most.
What can you elaborate about the Medicare Advantage?
So,
Some people are not gonna be covered.
correct. Unfortunately, a lot of these managed care insurance companies don't allow us to see. We do have several that we see, such as Brand New Day or Align. Those insurance questions, Patrick in the back can shed light onto that in more detail. They're just very restrictive, unfortunately.
A great deal of the answers to the questions you've given us today will change 6 months from now as we grow. I mean, it's inevitable, right? And so we're gonna have another meeting to understand how it's going to continue, how to get your reassurance that you're available to us when we need you, as we see everybody join.
Correct. Me personally, I have no intention of marketing myself to another community here in Palm Desert.
Good.
Okay? So I will be your established physician here. And as we get more patients, I want to be a further established presence here, meaning that we would love to give doc talks, okay, such as this, where does someone want to talk about hypertension, or what does it mean about health and brain health at this age, and have informal conversations about education in terms of healthcare concerns. So in terms of right now, it's just us here. And if we are going to grow in this area, we will hire other providers to go elsewhere. Hopefully that provides some reassurance. I think it is going to be best if Natalie and I will be in the back, and if anyone has any other personal questions or logistic questions, we can take it from there.
Thank you.
Thank you, Dr. Conlon.